All good? Let me see if I can. My problem with this is. I don't know if I. Do we want to record this one? And are they going to be able to hear me or do you want to? Okay.
It is being, and it'll be put out on.
Because I'll record the Zoom. So you don't want to do, and then we can kind of
Right.
choose whichever one, just because I don't know if they're gonna have a hard time.
Okay.
They shouldn't. That's the speaker or this
Right
is the
here.
speaker.
Yeah.
Okay.
Morning. Not bad. Yeah. But I'm married to a farmer, so now we need some rain.
Okay.
You know, it's never perfect.
It's been a week, I heard.
Yeah, I think so. There's a possibility, I think, of losing today.
Wow.
Yeah, it is.
Okay. I think we are, let's see, unmuted. Sounds like we're unmuted. All right, good morning, everyone. My name is April. I'm from Gibson and I recognize some of your faces. I think from last year, I definitely recognize you.
Thanks.
So I'm going to go through that's a good thing. Not a bad thing.
You didn't scare me off. I'm back.
All right. I'm going to go through open enrollment. I'm going to go through the changes. There's some things that I personally.
Is this bothering you?
No.
Do we want to mute this? Not mute me, but mute, just so we don't have background. Good. Uh-oh. Be here until 2. So if anyone has a personal question that you want to ask, I'm around. If you have a group question, you could do so at the end. If you have personal questions, let's hold those. I don't want to have your personal information out with the group. I've done this for 21 years, so I want to preface kind of starting that off. And in my 21 years, I think the changes that are being implemented this year are enhancements. So we're going to jump right in. So this is your open enrollment. Employee Navigator is open right now through the 7th. So if you're making changes, you're going to need to go into the system and have that done no later than the 7th. If you're not making changes to your benefits, you don't have to go in the system at all. What you currently have is just going to roll forward and be effective 7/1. It is important that you check what you have now, though, because the elections that you make on 7/1 are locked in until next June 30th. That is not a Sanilac County rule, that's an IRS rule. So because they allow you to have your contributions, what you pay, taken out on a pre-tax basis, the IRS says those contributions have to be in place through the next plan year. So again, very important. I would still recommend that you go into the system and just double check. It's only going to take you maybe 5 minutes. If you have challenges getting into Navigator, you can let Jody know. But it's a pretty user-friendly system and it's the same system that you guys have had in place. Oops. Uh-oh, now it's not working. There we go. So again, elections are going to be in effect 7/1 through June 30th. And again, if you're not making any changes, you don't need to go into the system at all. Qualified change of status is the only exception to being able to make a change during the course of the plan year. So if you get married, you have a baby, you have a child who ages out, which would be 26. You get divorced, you adopt a child, any of those things are qualified events defined by the IRS, and you will have 30 days to make a change. That's the critical time period. So if you get divorced, or I'm going to use the example of if you get married. If you get married, it's critical that you add that spouse on within 30 days of the point starting with your marriage date. If you don't, you have to wait until the next open enrollment. So again, get with Jody, you'll go into Employee Navigator, you'll add that individual, and then she will hit the button to send it over to add that person onto your plans. Things to consider. So there's a lot of things that the county looks at when they are trying to make decisions as to what's going to occur with not only your benefits, but the amount that you guys pay out of your paycheck to have those benefits. So looking at the plan costs, not just what you guys are paying, but also what the county is paying. And the reason that that, of course, is important is if you guys are paying a set dollar amount, but claims are crazy through the plan costs go up, those costs are going to partially be passed on to you guys. So that's one of the things when we're talking about the county's costs that I always like to emphasize is they really are doing everything they can to try and keep those costs low for you guys. And you're going to see a couple of things implemented this year to try and help that. You guys had several large claims this year, which are driving up costs. Whether you were self-funded or you were fully insured, any insurer is going to look at those large claims and say, how does that compare with the premium that we're getting? So that is something that comes into play are those large claims. And it's nothing that anybody here or anybody at Gibson or anyone at the county can do, right? We don't want to say you can't use the insurance because you've got a large claim. That's what it's there to do, is protect everyone. There's additional things called trend that happen on an annual basis. These are going to be increased costs with medical advancements, pharmaceuticals. If you're sitting at home and you're watching the commercials for all these new drugs that come out, specifically things like they're considered to be biologics. These are things that advancements that do fabulous things for individuals that have had to struggle with things like psoriatic arthritis, things that couldn't be really managed well, now can be managed well. But some of those drugs are upwards of $14,000 per month. So that's something else to keep in mind when you're looking at it. You guys have also had no plan design changes for the past 3 years. That is very unheard of. Okay, I didn't touch it that time. That's very unheard of in this day and age. And when I say plan changes, deductibles, co-pays, co-insurance, you guys have not had any changes to any of those things. And I will tell you, I've got 15 clients and we've got about 70 overall in our agency. You guys are probably in the 3% that we're able to sit in front of and say that. And then, of course, maintaining high quality, affordable coverage is a huge consideration when the county is looking at any potential changes. So what are the changes? So you are having a network change, and this is basically you're going from the Aetna network, which is what you've done now. So if you're looking to see if your doctor's in network, currently you guys have Aetna. That's what you're looking to see if your doctor participates in. Effective 7/1, that's going to be changing to Cofinity or First Health. So when you're asking your doctor, do you participate? You want to ask them if they take Cofinity. First Health is really if you're out of state. So if you're out of state traveling, First Health is going to be the network. I will tell you that Cofinity is, I can't say 100% as far as the doctors that are in. It's very close. It's about 98%. So there are going to be some doctors that are in that were not before, and there may be some that aren't that were in before. So I would recommend a couple of things. One, call Quantum Health. If none of you have used that, I would recommend that you do. Apparently This
Time's
doesn't
out.
like me. Okay. I didn't set it up that way. So Quantum is, it's built into your medical plan and they can answer all kinds of questions for you. If you call and say, I want to find out if my doctor participates, or I want to find a new doctor, and you let them know what your zip code is, they'll actually help you find a doctor and tell you if your doctor participates. Of course, you can call your doctor as well, or you can look on the Cofinity website. In the benefit guide, there is the Cofinity website listed. What I would strongly recommend is that you type the first couple letters only of your doctor's last name. The website is finicky. I typed in my entire doctor's name. It didn't find him. I went back and typed in the first two. He popped right up. So best bet always, though, Quantum, or call your doctor and ask. Again, Quantum Health and Meritain are there to assist you through phone, app, or website. Your benefit guide and also Employee Navigator are great resources as well. And then this is your instructions. I'm not going to read through line by line. This presentation is also going to be available for you. And those instructions are also in the benefit guide. So this is going to tell you how to go online and look for your doctor. The other thing that's changing is your pharmacy. So the process is going to work the exact same way as it does now. You go to the pharmacy, give them your ID card, and they're going to process your prescription. I did a 12-month look back, meaning anybody that is taking a prescription now or within the past 12 months, is your pharmacy still in network? And it is. There was not one that wasn't in TrueRx that's in your current. So that should be a complete pass through. You guys shouldn't see anything different on that at all. The other difference is going to be you have a new specialty and high cost drug administrator called Sharks. And everybody asks, why is it called Sharks? It's because they take a bite out of prescription costs. So if you're taking a medication that is $350 or more, you're going to need to go through Sharks. You're going to go to the pharmacy. You're going to get your first fill just like you normally do. Then you're going to get an outreach from Sharks. They're actually going to call you. They're going to email you, and I don't know how to keep this from doing this. And they're going to send you a snail mail letter. It is critical that you engage with them. It's mandatory. What Sharks does is they're going to ask you to fill out a HIPAA privacy form, which basically gives them access to your information. Then they're going to look at 3 separate methods for getting your medication. And about 98% of the time, that medication is going to be completely free to you. They're going to mail it to your home, and you get approved at I believe it's an 8-month time span. So if for some reason they can't find that medication for free, then they're going to look for a copay card. So manufacturers have, again, if you ever watch TV at night, AbbVie is always the example that I'll give. It'll say, if you can't afford your prescription, AbbVie may be able to help. So they'll look to see if there is a copay card available. If for some reason neither of those options are available, then they're going to do international sourcing. So they've got contracts with Canadian companies, a lot of different companies where they're able to get those drugs, the exact same medication, for usually at least half the cost, sometimes less than that, sometimes a quarter of the cost. So again, saving money to you. A lot of times, again, you can get the meds for free, and also saving money to the plan. So hopefully next year when I'm sitting here, we can say, great news, costs are down. So are the costs that you guys are paying. So again, super easy. It's not anything you're going to do. You're going to have those questions that they're going to ask, and then they're going to do everything on the backside. And then they'll let you know, you'll get a concierge or an advocate, and they'll reach out to you and let you know, we've gotten the drug this way. We've gotten the drug that way. It's going to be mailed directly to your home at no cost to you. I always like to highlight the fact that the international drugs are not something that somebody in Mexico is making in their bathtub, that they are their efficacy has to be 100% the same as what the FDA approves. So critical thing that I like to highlight.
April, do you mind if I, just for the folks here and the folks online too, we had quite a few meetings, and as April said, this was one of the tactics we're hoping that can help us hopefully see next year a little bit of a cost reduction, and really what it turned into for us as we started talking about it was it was really a disservice for us not to do this because of the ease of how this program will be administered and the potential savings that it could create, I think, for our employees in the plan moving forward. So
Yeah, on a conservative basis, we estimated about $90,000 in savings for 1 year based on the drugs that we saw that were being taken. So again, that's a nice savings. That was just on the plan side. That's not including the costs that you guys are going to have waived in getting those drugs for free.
Is it something the county has to subscribe to?
It's a plan that's being administered. So it's being added to your health plan. So it's a part of your health plan, just like Meritain, just like TrueRx. This is something that you have to do. So if you are taking a medication that is $350 or higher, you're going to need to go through Sharks.
But it's a extra cost to the county.
It is an extra cost, but that $90,000 in savings is after that cost. So it's not, you're going to pay $30,000 and then 90,000 is subtracted, and really it's only a $60,000 savings. That 90,000 is after what the cost of this program is. So it's on top of that additional. And the point of this is really, again, to lower plan costs so that when we're sitting here next year, you guys are going to have lower costs overall, because it's not just the medical claims that are impacting and driving up your costs. Again, we've seen some of these drugs that are $14,000 a month for one. So this is going to help lower those costs.
I'm sorry to take your time, but give me an example. Is it like chemotherapy? Is it?
Humira, for example, is $8,500 a month. Humira treats psoriatic arthritis.
That's the one you.
That's one of them.
Okay.
And you guys have, quite a few of those. You have a lot of high cost diabetic medications. We used to see those diabetic medications on the low end. In the last 7 years, they've shot up. My uncle, for example, was taking a diabetic medication, insulin, and he was paying, I want to say like $50 or $60 a month. The cost of that medication now is almost $600 a month. So it's not just things like Humira, but there are a lot of biologic drugs that are out there as well. And some of them, thankfully, knock on wood, you guys don't have the higher end. I have a client who has a child who's on a medication that's $120,000. I mean, it's not cheap, and you can't say we're not going to cover that. So that's a good question.
Okay, thank you.
You're welcome. So I've got a couple little videos in here. Normally I wouldn't put a video in, but I want to make sure that I'm hitting everything. Uh-oh, it doesn't look like it's going to play with the clicker.
Oh, probably because
I'm not sure what we need to do to make it play. I know when we ran the regular presentation, it popped up and played. There was a play button, so maybe go back to and the point of these are to really make sure that I'm not missing anything. I want to make sure that I'm hitting all the key points and you guys are aware of how it runs.
it was.
It's going to be that. Yep. Go down 3 or 4 more right there. TrueRx. It's not playing from there either. All right. Well, we'll skip over that. There's also one for Sharks. I don't know why these aren't playing, but when we send out the presentation, they are both embedded in there. So I'm not quite sure why they're not playing, but it gives a little bit more information. The TrueRx goes into details on how you can look up and compare costs under your medication. So if you're taking a medication that's under $350, That's still a lot of money. And so you can go into their app, you can put the name of the medication, the dosage that you're on, and how comfortable you are, and do I want to go 5 miles? Do I want to go 10 miles? And it'll actually show you the costs between the different pharmacies. I take a drug that's $240 a month. I have 2 pharmacies literally directly across the street. One's a CVS, one's a Walgreens. There is a $75 difference for me to drive across to the other pharmacies. So this is total transparency. You can see the costs and then it'll help you out, especially if you're on the high deductible health plan. So
Similar to GoodRx.
exactly.
Okay.
Again, Sharks, this one actually looks like it's going to play. Do we have the ability to click on the little red? We should have sound though. Maybe not. All right, we'll just skip over it. But again, this is going to walk you through in a little bit more detail, the process with Sharks. It is key if you see Sharks pop up on your phone that you take that call. Takes maybe 15 minutes to give them the information that they need. Sometimes it can take 4 weeks, I've seen 5 weeks on the high end for them to get the information and get that medication for you. Again, they're going to go through, the first step is what's called a PAP or a physician assistance program. Again, if you can't get that, then they go to the copay card, then they go international shipping. You can get up to 2 fills regular at your pharmacy while that process is going on. We don't want anyone to not be able to get their medication. And the other question that normally comes up is like with physician assistance programs or patient assistance, it is income driven. And so a lot of people hear that and go, I'm not going to qualify. The income threshold is high. So it's not like, poverty level. I think the last time I checked, it might have been $80,000 or $90,000. So if you are at the high end, you're making a lot of money, congratulations, but you'll probably end up with like the mail order, the international sourcing, but definitely still check, still make sure you're giving them that information, let them do the sourcing and save you and the plan some money. The other new thing is called Edison Healthcare. This is critical concierge care, if you will. This program I cannot speak high enough about. If you are an individual that has a critical issue that comes up, these are going to be cancer, spine surgery, end-stage renal disease, things that are life-threatening, really. Edison Healthcare is going to be there to assist you. There is no cost to you whatsoever. You get white glove service, meaning they're going to work with the top nationwide facilities, places like Mayo Clinic, Cleveland Clinic. So these are, again, the top tier best facilities in the nation for handling these specific conditions. You're going to be able to have travel, all of your care, all of your claims paid for 100%. You're not paying anything out of pocket. The only caveat to this is if you are enrolled in the high deductible health plan. Of course, the IRS has their hand on that because it is something that's a tax advantage, giving you the ability to have the HSA. So basically, in that case, instead of having that $3,300 deductible, it's going to take it down to the IRS minimum of $1,500. So you'll still have that, but everything else will be paid 100%. If you're in one of the other 2 plans, you're not paying a penny out of pocket. If you're going to one of those places like the Mayo Clinic, for example, it's going to be travel for yourself and a companion. So again, they're trying to make it as easy as possible for you. Your Edison concierge is going to reach out to you. They're going to coordinate the care. They're going to coordinate the airfare. They're going to coordinate the hotel. Again, they're not putting you up in some tiny little hotel that you've never heard of. You're going to get nice care. I have a couple of clients who have had individuals, unfortunately, that have had to use this. And I say unfortunately, because again, They're looking at extremely significant health situations if you're using this. When you get to the facility, I'll continue to use Mayo as an example. You get there, you have a concierge waiting for you. You say, I'm going to be there at 10. They are literally in the lobby waiting for you. They're walking you back and they're holding your hand through the entire process. You're not sitting in a waiting room. So again, white glove treatment from start to finish. Once you get to a point where they say, I'm going to use cancer as an example, the surgery went great, we're ready to transition you back, then you're going to be escorted again via air, whatever the situation, back home, and your care will be transitioned back to whatever local physician you're utilizing. A lot of people say, okay, great. So this sounds like it's going to cost the plan a lot of money. It actually doesn't. There are bundled contracts that Edison has with these facilities. So it's saving not only you, but it's saving the plan money as well. So making sure that you guys are getting the best care possible at the lowest price for the plan. So really, again, something I hope nobody in this room ever has to use, because these are high level, very serious conditions, but a great benefit if you do.
April, if you don't mind again. This was another thing we looked at when it was presented in, I think what was pretty telling when Jody and I sat in on the call, was first off, I guess, having these facilities available to our employees, because being able to reach out and go to these centers. I mean, personally, I have somebody close in my family who had to go through a situation where they ended up at the Mayo Clinic and said that would be the first thing they would tell somebody if they ever went through something like that, is that they wouldn't do anything short of going right back to a facility such as Mayo. The other thing we looked at was, I think was pretty telling on the phone call, was the number of misdiagnoses that sometimes we get at our, I don't know if I'd say local, at your smaller facilities. And they noted that sometimes it's just a matter of, you go to one of these facilities and there's been a cancer diagnosis, and then you go out to Mayo and they find maybe it's not as severe, or it's not cancer, or there's something else that goes on. And I think it was a little disheartening, I think, when we saw the number of misdiagnoses, and then they got into some areas where sometimes doctors will diagnose things because there's a little bit of a personal agenda. So I think this can benefit the employees if they have to use it. It can also benefit our plan in that if there's a situation where sometimes you want a second opinion, sometimes it can completely change the scope of potential treatment and costs that hit our plan. So,
and that's a good point. So that's the other part of this plan. And the part that a lot of people may use is free second opinions. So if you're going to a second opinion now, you're going to have to make an appointment with some, first you have to research, find another facility. Then you've got to make an appointment. You've got to wait to get in. Again, the physician has a stake in what they are saying to you. I'm not saying that physicians are bad, but sometimes you've got physicians that maybe aren't an expert in something. This is an independent panel of physicians. So if you are getting a second opinion, the first thing they're going to do is get your medical records sent over, and this independent panel is going to review it and basically say, yes, we feel like you should have this care, or no, we think that maybe there's a better course of action. I'm going to use spine surgeries, for example. The most recent information that came out, 45% of spine surgeries are misdiagnosed. They can be better treated with aggressive physical therapy. If you know someone who has had a spine surgery, it's an extremely hard surgery to have, meaning a lot of times people have issues where they have to go back in, have another vertebrae fused. It's an extremely long and painful recovery. And so overall, it's just, if you need it, get it. But if there is a huge chance that you could get better with aggressive physical therapy, let's try that first. And again, these are not doctors that have any financial incentive to decide one way or another. They're not tied to your plan. They're an independent review board. So again, very, very valuable. This is a voluntary benefit, both parts, the white glove as well as the second opinions. So not anything you have to use, but definitely something that I would suggest if you're in a situation, it's not costing you anything. And to Nathan's point, wouldn't you want the best care possible? If I know somebody who has cancer, I want them utilizing this versus going to a local hospital that may not be performing that situation, performing that procedure on a regular basis. You've got an additional program called the Samaritan Fund. This is for a little bit more common high cost care. So again, completely voluntary. This is not something that you have to utilize. And what Samaritan Fund does, it's a fund that looks for free voluntary plans. So if you are an individual that has a high cost situation, I'll give an example of somebody that's not as serious as a cancer, but maybe I've got a surgery coming up that's not that serious, but I know that the surgery is going to have ongoing care that could take, a couple more months. That will give an example for this situation. Maybe it's going to cost $250,000 in care. You can reach out to the Samaritan Fund individual. Again, they're called an advocate. They're going to take some information from you. If you qualify, because they're going to say, yep, we've got a plan that's going to fit you, or no, we don't. If you qualify, they're basically going to find you an individual plan that will cover 100% of those services at no cost to you. So you would come off of the Sanilac County plan. You would be on this plan for free for the course of a year. And then next open enrollment, hopefully that situation has resolved itself and you have the ability to come back onto the county plan. Again, completely voluntary, but two huge benefits. One, you're getting the care for free. And two, those costs are coming off of the plan, which again is helping you to pay less.
What does that do with your dependents? They go with you on that plan as well?
Yes. So if you've got a husband, a spouse, children that are covered currently, they are going to go with you. No one is going to do anything to penalize you or I've got a daughter and now she's not going to have coverage. So it is full coverage for anybody that's on your plan. And this is another video that's embedded that's not playing for whatever reason, but in the presentation, it's going to explain to you exactly how it works. And again, if you say, I want this, and you reach out to them, they're going to take that information and they'll tell you, yes, we have someone that's going to cover it for you, or no, we think it's better for you to stay in the plan. And just like it says Samaritan Fund, this is funded by individual donations, by donors that have a lot of money that want to put into the fund. And so they are there really to help offset individuals that, are looking at significant medical costs.
April, did you want to hit on too? A lot of times in addition to this, there is usually some finances provided to people.
Yeah. So with that debit card, what it's showing is, let's say they put me into, they find an individual plan for myself and my kids. They're paying the cost of that plan. So I'm not paying the $400 or whatever it may be per month to have that coverage. And then like it showed before, you're going to get a debit card. And so that's going to pay for if you go to the doctor and there's a copay. You use that debit card, which is again covered by the fund, so that your out-of-pocket cost is going to be zero. So the setup of that plan, they may put you into a $250 deductible with a $30 copay. That debit card is going to cover those costs. So it truly is nothing out of your pocket.
Any limit?
Don't. That's actually an ACA regulation that passed a while back. There can't be any limits on benefits. It's got to be unlimited. And again, the point of this is to make sure that you guys are getting the best care. We want to make sure that financial consideration isn't something that's going to stop someone from getting care. I always use diabetics as an example. We don't want, I gave the example of my uncle. We don't want him not taking his insulin. And I actually found out he was rationing his insulin, taking it in half doses, which does nothing for you. So what's going to happen in that case? He's going to end up at some point probably going into diabetic shock, which is going to impact his health significantly, could impact kidneys, livers. There's a whole lot of things. So not only is it significantly impacting his health, he's going to end up paying more out of pocket now to address that situation. And on the flip side, it's going to now be a significant cost to the plan that maybe wasn't there before. And then again, next renewal, all of that's going to come into play when there are considerations as to what the contributions you guys pay for coverage is going to be. So this is benefiting you by moving you off of the plan, getting you 100% coverage, and also moving those claims off of the plan. So it's a win-win. Does that make sense? I strongly recommend that you guys review this presentation and click, and those 3 videos are in there: TrueRx, Sharks, and Samaritan Fund. I really wanted to make sure that everyone understood how those works. Edison, I didn't put a video in there for because it's pretty straightforward. There's going to be outreach. Again, they're going to get a HIPAA form so that they can get your medical records. Whether you're looking at a second opinion or already, I have this significant thing that's going on. They're going to need that HIPAA form, and then they're going to start working with you. You will have one person assigned to you who's going to walk you through the entire process. That's the same for Samaritan Fund as well.
Is this the first time that these programs have been available, or were they available last year?
They were not available as a part of your plan last year, but as far as how long they've been around for years. They're not new. We would never want you guys to be the guinea pig on anything.
I just wondered if there were savings that we could have seen for this last plan year that we did not.
So Samaritan Fund basically is not rolled out unless there is things that we are seeing on the plan. So to your point earlier, the question on Edison Health, there are costs to all of these plans, just like everything else. So we don't want to say our role as your consultant, we don't want to say, oh, add this, this, and this, even though you don't have any claims that are going to fall under it. Now the plan is absorbing more
Seen
costs.
the claims and now you're offering them.
Exactly.
And so, but as a cost to the county,
Right.
the county, these benefits are included in the county's
Yes.
premiums.
But when we're looking at that, again, we're only saying we want this if there is a significant projected savings. It's not something we want to add that's just going to be a cost. So all 3 of those programs, but specifically Edison and Samaritan Fund, those are things that are going to be cost neutral. They're actually going to generate savings. So it's not something, again, where the cost is $100,000 and we're only saying you're going to get $50,000 of savings out of it. If it's $50,000 in cost, we're projecting $100,000 in savings. So overall, it's a savings to the company. So that is the reason that they were not put in last year, because the prior year, your plan ran well. This year, it
Not
didn't.
so well.
Right. And the thing I will say too is when you're looking at claims, you normally see, I refer to it as a roller coaster. So you'll see 3 years of great, plan run, and then 1 bad year. And then again, usually about 3 years of great run, and then maybe 1 bad year. Every now and again, you have somebody who does fabulous and they have a great run. But again, you can't stop medical things that happen. There are going to be individuals that have issues. There are going to be high cost drugs. There are going to be individuals that have surgeries. So these provisions that are being put in place are going to be things based on how your plan is currently running and how it has ran this year that are going to help manage and offset that. So that next year you guys have a much better year.
So what's the turnaround time of them saying, okay, we are gonna, like the Edison plan or that Samaritan, what's the turnaround time
Edison
in
is
regards
fast.
to? So is it like we have to contact them? Is that how it happens?
So there's
Or-
two options. They're going to reach out to you. So they're getting a file, specifically Edison, but Samaritan Fund gets it as well. So Edison
File
is getting
from,
a file
like,
from
Our
Meritage.
administrator?
Yep, showing the claims. And then that's going to identify, okay, April has I hate giving, I'm going to use Jane Doe because I'm a little bit nervous about that, but they're going to say, okay, Jane Doe has some significant claims that are coming in. Maybe they're prescriptions. Okay, we know she's getting on drugs that are going to indicate a cancer diagnosis. Then they're going to reach out. So you're going to get a call, you're going to get an email, and you're also going to get a snail mail letter saying, we've identified you. Please contact us. And the turnaround time from Edison is about 3 days. It's very fast. So the first step is going to be, again, they need to get your records because they're just getting claims that are indicating. They're going to need you to fill out a HIPAA form. They're going to reach out to your physicians. They're going to get your medical records. They're going to send those to that independent review board who's going to look at it. And then they're going to say, okay, we feel like you should go to Mayo Clinic and have this handled. Or no, we feel like, what's going on right now, how it's being handled is appropriate. But again, it's usually about a 3-day period from the point the initial claims file comes over to them to the point that you are in having those, medical records reviewed. And then it is a quick process from that point, from the point they say, yes, you need to be going to Mayo to the point that you're there.
So
Usually a
how are
couple
they gonna
weeks.
know that? I mean, we're dealing with doctors. I'm just looking at my own husband's scenario. And then I'm gonna submit all my records to these people and then they're gonna tell me that I should be doing something different.
So there's
kind of uncomfortable about
There's an
that.
independent review board of the top physicians in the US that are looking at these. Again, not tied to Meritain. They're going to look at it. And I believe the last one I saw, there were 6 physicians. And again, you don't have to use it. It's voluntary.
It's a suggestion.
It's a suggestion. We hope that you do because again, the care is phenomenal, but you do not have to. But that individual review board, which are physicians, they are not nurse practitioners. They're not John Doe that works down the road who has a family practice. These are the experts in their fields that are reviewing it. And then they're going to say, yes, we feel like this is an aggressive cancer that you should be going to Cleveland Clinic. We want to have surgery. We want to get it out. And then we're going to do, chemo afterwards, for example.
And it's not income based at all?
That it has nothing to do with your income at all. That's not a consideration at all. It is strictly based on the diagnosis. 100%.
And that more than likely is the most severe cases
Yes,
versus they may say, no, you're not for our program, but here's another alternative.
exactly. Yep. These are, again, the top tier of extremely serious situations. And I'll tell you an example. We had, I have a client who had an employee that just went through this. It was the wife, and she was terrified and didn't want to do it. She actually went back and forth. The flight was booked twice. She canceled. She ended up going, and she was so pleased that when it came time for the chemo, and I don't recommend this because chemo can be done, at most facilities, but after the surgery, she was like, I'm staying and I'm having the chemo here, which she did, but it transferred back into the plan. So regular costs came into play. Yeah, it wasn't something where she just gets to stay there for free forever. The hotel stops, she's responsible for travel. But I think that says a lot, just from a reassurance standpoint of, okay, I am really impressed with how this was handled. The other big piece on that is the quickness in being able to get into one of those centers. I know someone who didn't have Edison who ended up going to Cleveland Clinic and it took them almost 2 months to get in. So you're getting in right away. Again, the goal is to make sure that your situation is being handled quickly, handled correctly, and that you are getting the best outcome so that your health, you have the best chance possible. But again, I understand and you don't, if you were to send it in, someone looked at it and you weren't comfortable with what they said, you don't have to use it. You
But
don't
is
have
it
to
just
send it to
Mayo
them.
Clinic, or I mean,
No.
I know we have some great hospitals like U of M, Henry Ford here that are specialty clinics. Are you specifying just Mayo?
It's not
Clinic,
just
or-
Mayo, it's not just
or
Cleveland.
is
I
there like
gave
a
those.
list of different,
There is, if you contact or you contact Edison, they'll give you, I just gave 2 examples. It's going to be based on what the condition is. So these are centers of excellence. These are facilities that have been outlined and identified as the top in the United States. So it's not going to be every facility. It's not going to be, most of the time, I don't think Henry Ford is on that list at all, because while they are a great facility, they are not in that very top tier. These are the top facilities by condition that have been identified in the United States, and not just identified by Edison, identified across the board. Does that answer your question?
well, I was just curious, is like, if we have like U of M or something, that they would cover the costs
No.
there. So, that they're one of those facilities, they would cover the cost still without having to ship to, cross country.
Yeah, I know U of M isn't in it. I know that Henry Ford isn't in it. So that again, you don't have to go there, but it has to be one of those named centers of excellence for it to fall in. And again, the reasoning behind that is not only to make sure that you guys are getting the best care, but they've got those bundled price arrangements. So if you're going to U of M, or you're just saying, I want to go here or I want to go there because it's a good facility, and I'm a huge proponent of U of M, they're not going to get any discount. So having you go there and pay for Edison on top of it is going to end up being a cost to the plan. So it's not going to be a savings. So again, the thought behind these these plans is to make sure you guys are getting the best care as quickly as possible, but while also saving the plan and you money as well. You can still utilize the second opinion. Anybody can utilize the second opinions, and I would strongly recommend it, especially if it's something that's any kind of surgery, outside of something very minor. If my son breaks his arm and he has to go in to have surgery to set the bone, I'm not going to get a second opinion. The arm is broken, the bone has to be set. But if you're looking at something significant, I would definitely recommend the second opinion, especially with spine. Spine is extremely misdiagnosed, but with cancers as well.
I was shocked when they got into cancer, the number of.
Yeah.
Particularly the number of misdiagnoses with cancer. I guess I thought that was fairly straightforward.
Yeah, again, I'll give myself as an example. And I think you may be aware of it. Last September, I went to the hospital, to the ER for something which I thought was just a really bad flu that had gone on. This was my local hospital. I walked out of there. First of all, my daughter was with me, and they told me they ran a CAT scan, they ran all this stuff. And I walked out thinking I could possibly have liver cancer, that I had a mass in my lung that could possibly be liver or lung cancer. And they said that I could possibly be in renal failure. It ended up being, after months, and I went to all these different specialists, it was nothing. The spot in my lung was because of COVID. The mass on my liver was because I'm overweight. It was a fatty deposit. But the whole point of that is I was diagnosed with 2 different cancer, and neither of them, thankfully, were cancer. And the renal failure was something that my doctor was like, you were on a medication, you were dehydrated. The hospital should have caught that. So again, hugely misdiagnosed. And so those second opinions, that would have been valuable for me if at the time we had it, which thankfully we have it now as a company individually. I'm not going to go through because we've got about 8 minutes and I want to be cognizant of all of your time. The next few slides are all just a recap of what your plans are. I think I went through all of these in detail last year. Again, it's in the presentation. It's also in your benefit guides. And then if you go into Navigator, and I believe also on the shared drive, there is long, detailed benefit summaries. So on each of your medical plans, obviously this has 9 lines. There's a whole lot more detail than these 9 lines. This is meant for me to not have this presentation be 80 pages long. So I'm going to skip past all of this. This is going again into more detail on sharks. This is a piece that I want to remind everyone of because not a lot of people are utilizing this. You guys have Teladoc. Every single person that has the plan has Teladoc. This gives you free online or phone visits for yourself and any covered dependents, 24 hours a day, 7 days a week, 365 days a year. Strongly recommend anybody that has a smartphone to download this. It's going to ask you some general health questions, just like the questionnaire you answer when you go to the doctor. And the reasoning behind that is, again, I'll use myself as an example. I have a kid who gets ear infections all of the time. I can call from my couch in my pajamas at 4 o'clock in the morning, talk to a licensed physician who can diagnose it and call in my prescription for me. If I've got his information in there already, they can send the information over to his pediatrician. They know what pharmacy we go to. They can send the prescription right over there. You're still going to have your normal prescription copay, but outside of this, it's free. There's no cost to you.
I thought our plan got charged for that.
This is built into your plan.
No charge at all.
No charge at all. I think at one point you guys had a plan.
Different.
It was Health Joy, which was pretty much the same thing, but there was a charge to the plan. This is
Okay,
built
thank
in,
you.
no
Yeah.
cost.
Okay, thank you.
April, isn't there such a thing too, that when this is utilized, that again, rather than going to the doctor and that, then hitting the plan for that visit, when you go online, that it avoids.
It avoids that,
hit to
yep.
to our plan, so it could create some savings as well.
Yeah, average doctor's office visit is between 160 and 220. That's what the plan is being charged after the discount that comes into play from from Meritain. So if you're doing this, again, that 160 to 220 is not hitting the plan. So it's saving you. Again, it's saving the plan as well. And it can be used for pretty much anything that's non-emergent. So obviously, if you're having chest pains, your kid has a broken bone, don't call Teladoc. And how it works is you call in, they're going to ask you you're going to get a concierge. They're going to ask you some basic questions, again, to make sure that you really should be calling them. And then a doctor will call you back. It's usually about 15 minutes. I had to call on Christmas Eve this year, and it was about a 2.5 hour wait. And it was because there's so many people calling, you can't get anywhere. But definitely, again, a valuable benefit. I always call because at that point, I don't want to deal with the video, but you can go online and do it. You can use, FaceTime and do it through a video. There was a time that my kid had a rash that ended up being poison ivy. They asked us to switch to video so that they could see what it was. There may be times as well, the one time with the ear infection that they said, we can call this in, but we still would recommend that you go see your doctor because it sounds like it could be something else. But again, a great tool, and they can send that information over to your doctor on the backside as well so that they've got a record of it.
Hey, Nathan, is there plans or is there something we can help from like a wellness perspective? So, 60 days from now, I may forget that, hey, I can call the doc versus, it used to be going to the doc in the box. urgent care.
Mhm.
But is there something we can do to help our staff countywide? Recognize that, you know, it's the cultural change.
Mhm.
Hey, every couple months you get a newsletter that says, hey, don't forget, you can call your doctor and get service by a
We-
cell phone now.
We've talked to
Is that-
Gibson about that specifically, and they said they do have folks who do send out newsletters. Did you say it was monthly, April, or periodically?
It's complete. Yeah, normally it's about every other month.
Yeah,
Some do it quarterly, but yeah, we can do, and you guys could do, you know, I don't know if you have a lot of folks that do paper paychecks still. But you could have it added to a paycheck. I know a lot of your people are out on the road, but you could have it be in break rooms. If you do have folks that are more in-house, you can do email pushes. You can put it in Navigator. There's a lot of ways that we can do it. So yeah, absolutely. However, you know, works best for you guys. And on that urgent care, when you use the doc in the box, so that cost range that I gave, that's for a regular doctor. If you're looking at urgent care, and this is just to walk in and be seen, it's about $500. So again, it's a nice savings, and you're paying for that convenience. When you're looking at hospital emergency room, that's upwards of a minimum usually of $750. And that's to go in, answer those few questions that they ask you, have them take your weight, your blood pressure. You're looking at more if they're running tests. So it's an extremely valuable benefit. And also, you know, not only from the convenience of being able to do it from home, but you're avoiding the germs too. So if it is something, you know, an ear infection, I don't want to go into a room where there's a whole lot of people that probably have the flu. I can now do that from home without exposing myself and whoever else I'm taking to those germs.
Are you gonna cover the rate changes at all, April, or is that, you're not gonna have time to? Because most of my questions were,
Rate related.
yes, and how that was. Because I came last year and you said Jody's not sitting down in her office pulling these rates out of the air.
And that's the
Basically.
same.
Yeah. Same answer.
Nathan got
applies
added to that.
this
He's
year.
not doing it either.
Yeah, you know, there's been, I understand, and I've spoken to Nathan about the differences we've had in the high claims but like Tina's premium went up 212%, mine went up 59%, but overall, Nathan said the plan increase was in the teens, I want to say, but I don't understand how that all is.
Developed.
Yeah,
Yeah.
your HSA got cut in half or close to that. Your single subscriber plans all went down. You know, so tell me, you have an actuary, you
We
said.
do have an
or
actuary.
Someone who reviews. So now
They
we're
set.
gonna pay all this more money this year. If we have a good year, the 1 year we got a check. Remember, when Kathy Dorman was
Mhm.
here, there was an overage. We had overpaid. And we all got a little check. I don't remember. But it was like, woo-hoo, you know, but I guess those are my questions as to these rates are estimates moving forward based on prior history of how many years? Just one or?
So to answer the first part.
Yes, sorry.
That's okay.
Go on.
There's like 4 questions in there, but they're good ones.
Okay.
So on the rate setting, there are quite a few pieces that go into it. We being Gibson, work with a company called Wakely. It is an independent actuarial firm. That's all they do. You guys don't pay for it. It's a part of the service that we provide to you guys. They take all of your claims from this year, and then they actually go back 18 months, which is if you were fully insured, any actuary is going to do the same thing. They're going to look back 18 months, but they wait. And I'm not going to be extremely detailed on this because I'm not an actuary,
Okay.
but they wait the most recent, I think, 10 months of claims the most, because the goal is to make sure when the county is setting their budget for the year, what the projected claims are, that they're as accurate as possible. The last thing we want is to undershoot and then end up with a big deficit.
Is that what happened this last year?
Yes, the claims, I believe, when I looked at it last, we're running at 114%. So what you guys
Paid
paid,
in
yep, 114%, so 14%
over what was estimated.
over what was estimated. We actually went to some fully insured plans. So if you guys were to move back, for example, to like what you guys had before, it was between a 30 and a 40% increase to what you guys would be paying. And again, those rates are all developed by actuaries. So Blue Cross has their own actuaries, Priority Health has their own actuaries. So we are using an independent actuary, not tied to anyone, not tied to us, not tied to you guys. All Wakely does is actuary services, I guess is what you would call it. So they take all of those claims, the last 18 months, the most current 10 months. They look at what those dollars are, then they look at what the situations are that are going on. So those large claims or claims that haven't yet hit the large mark, but they're trending up. They're going to look at that and they're going to say, this one is going to continue based on prognosis, or hey, great news, this one's going to resolve within the next couple of months based on what the diagnosis is. They take all of that into account. They look at those prescriptions. Is this a prescription that's short-term that someone's going to be taking? Is this like a cancer, for example? Is this a diabetic medication that's going to go on? Is this a psoriatic arthritis? Then they say, okay, overall, this is what the costs are going to be. They add in admin fees. They add in the costs for those different components that you guys have in place. They add in stop loss, which is what protects you guys from those $2 million claims, the full amount hitting the plan. So they're adding all of that in, and then they're developing the rates. So that's where that 16.9%, it was about a $400,000 increase, I believe. That's where that's coming from. Then they break it down between the plans. Okay, what is the exposure on a plan basis? Then they break it down further. What's the exposure single couple family within those plans? So that, again, if I end up having everybody move over to the 2000 plan or to the 250, for example, which is the richest benefit plan, what's going to happen? Costs are going to go up, right? Because they're in the richer plan. So they're making sure that those different tiers are accurate. So that's why some tiers went up, some tiers went down. Because of, or I don't think any of them went down, why some went up higher than others is because, again, of how that's weighted.
Single subscriber all went down.
One down.
And again, that's based on those.
Those claims within that.
Yes. And the same thing, again, that's the way that Blue Cross, Priority Health, they all develop rates in the exact same manner. So sometimes you'll see a significantly lower rate if you're looking at a fully insured plan on one tier than you will on another. And you guys had some spouses, you had some claims that came in on other tiers, which again impacted that. There is a 8-page document that Wakely puts together and shows everything. I mean, it goes into details that I don't want to see. We have a senior data analyst that's assigned to your account within Gibson, who works closely with Wakely to understand all those pieces. And as we were looking to say, what if we added Edison? What if we added Sharks? How does that impact? So that she goes back and has Wakely update all of those rates to, again, come down to what those estimated costs are. And then the hard cap gets applied, which is, how much can the county contribute towards these costs? And then that breaks down and develops how much can be given to your HSA, how much is going to be required for you guys to have the different plans. And the county looked at a lot of different ways. What if we got rid of the hard cap and we did something else? So there were a lot of different things that were looked at. Again, is it going to be beneficial if we go back to a fully insured plan? How does that look? Really to try and make sure that they were giving you the best cost possible while still maintaining the highest coverage that could be available. And the last part of that question is, if you guys have a great year, which all of us are hoping, fingers crossed, these additional pieces that we're putting in place, also hoping maybe some of those claims that we project are better than what we thought, then you may be looking at a situation next year, perfect storm, where maybe rates can go down next year. It all depends on, how the plan plays out during the year. But again, in my 21 years, I've seen it, and I think I shared this with you, Nathan, 3 times, I think, where that didn't happen. Where, and I don't mean where you get a big decrease, but where I had a client that had 4 end-stage renal disease cases. I've never seen that before, ever. I hope I never see it again. But in that situation, ESRD can go on for years, and they did. So they had, a couple of really rough years. I will tell you, based on my time, I don't see anything that looks like it's going to go on for years and years with you guys. So again, hoping with Edison and Samaritan Fund that that's going to take those claims off so that we are sitting in a much better place next year. And the goal would be to hopefully lower rates.
So I know the rates, and I know I met with some of you guys previously, the increases are a lot for people to absorb. We understand that. And I think everybody saw the letter Brian had sent out originally. I guess I followed up on my letter in regards to when the numbers first rolled out, and it was, I think, 19.6%. And that's when I think Jody and I began the sleepless nights stage of our careers a little bit, because that was a very concerning number. Getting it down to 13.6 is not, I'm not trying to say it's good, but it was improvement. And what we kept talking about as we were meeting with Gibson over and over again is what we need to do is how can we make sure we don't have another year like this? Because that would be completely
Be devastating.
catastrophic, if you will, I guess, in insurance terms, to go through that again. So that's where we started implementing some of these things and balancing out the cost for the savings. And what we found was by implementing some of this stuff, it actually creates a savings to the plan, to the employees from the original number. So like I said, I know seeing a almost 14% increase doesn't feel great to anybody.
260%. Yeah, I mean, on our plans, I mean, it seems like it would be better if it was just across the board.
Well, so I talked to and I just had an email last week where I said, as far as sloping this, is there a way to adjust it so it's even across the board? The problem with that is you can't just try to apply it evenly across the board, because the claims aren't going to hit evenly across the board and the expenses with those are different. It's well beyond, I am not an actuary, it's well beyond my capabilities, but when she put it in terms as though, obviously, you have to look at where your claims are and you have to look at the potential expenses to a family compared to an individual. And they look at the historical and they look at the possibilities moving forward. So that's why some of those things don't seem fair within the plan. But when you think about it in regards to expenses, it makes a little more sense. So
It just seems like we're all one road, one of the.
Has it always been like that? I don't remember it being like that before.
It, even if you guys were fully insured, it's the same way. Blue Cross is setting their rates the exact same way based on how those claims are coming in. So you're not going to get proportional. There's an increase, you're not going to see a proportional. It's equal across the board. It's never like that. It's based on where those claims are coming in.
But we don't have Blue Cross.
Right. I'm giving that as an example for if you guys were to move back to a fully insured. You're right, you don't have. And one of the questions that Nathan did ask is what if we backed off and did exactly the same across the board? What you're going to end up with next year is me sitting here telling you guys you're getting a big increase again. I'd almost guarantee it. And the reason for that is the company is taking on more costs. And what happens to those costs next year when we're looking at hard cap it's going to go up. So they have to be proportionately set based on how the claims are coming in. And again, I'm not going to act like I'm an expert with how those are put together, and they're sometimes referred to as sloped. That's what those actuaries are doing. So they want to make sure that those rates are proportionate to the claims. And I'm just giving Blue Cross or Priority Health, whoever, because Meritain isn't a fully insured. You're not going to go out and get a full. And the difference between fully insured and self-funded, without getting into the weeds too far, fully insured, they say you're going to pay these rates regardless of how your plan runs. And that was the 30 to 40% increase to what you guys are paying now. With fully insured, you have or self-funded, you have the ability to add these additional cost savings vehicles, if you will, on to try and manage those claims. With fully insured, you don't. You get what they give you, and that's it, period. You guys with self-funded are paying those claims up to a stop loss amount. So on those years that you guys run really well, you're going to see those lower rates. If you're fully insured, I've not seen a fully insured group in 12 years. They got a reduction in costs. Just with trend alone, it's usually a 4 to 6 is great. If you're a 4 to 6, you're thrilled. 112%, 113% of loss ratio is not going to be a pleasant conversation. It's going to be a worse conversation than what we're having right now. And we wouldn't have the ability to put Edison in. You don't have the ability to add Samaritan Fund. You have the only ability that you have on a fully insured environment is to possibly change the pharmacy vendor. Everything else, you get what that carrier is giving you.
So does the retirement insurance affect us a
Their
lot?
claims, the retirees.
The retiree?
It is included as a
So
part of your
is there a
plan.
way to maybe segregate that and not have the worker people get penalized as much for that?
It's one of the things that we've
You
looked
know,
at.
because like I say, I mean, we are actually getting pay cuts and being penalized, like we're getting pay cuts and, I'm sure everyone's aware of that.
So there's a couple.
And that's not gonna end until, when does that gonna end, the retirement?
There's a couple different pieces in that. First of all, these high claims aren't coming in under your retirees. Not that I can sit here and say they never will, but the high claims that hit this year did not come in under your retiree population. The other thing that happens is when you start pulling people out of a plan, now your risk, what's considered your risk, goes up. So your risk pool becomes smaller. So your chances of having a large claim is higher. So if I've got more people in the plan, the chances are that it's gonna maintain or be a little lower. You guys have a unique population in the fact that we're not seeing huge claims come through under the retirees. Normally, that's where they come from. You guys aren't seeing that. I can't talk any more than that to the retiree benefit because it has to do with union contracts and things like that I have no control over. We did look at carving out the retiree population, and it was a cost to the plan. So it would not have brought the costs down. It would have increased it. That's a good question, Rod.
I know, Nancy, that was a question. I was talking to somebody in one of the units and they talked about maybe carving themselves out if that was possible. And I talked to April and exactly what she said. I mean, if we get into where units want to carve, say, for instance, Sheriff's Department wants to go in there, that risk group gets smaller, which has a potential to maybe make things a little more volatile. I mean, obviously the idea would be to get bigger. And I think there was some discussion about that in the past. Maybe there was some idea of merging with a medical care facility. And then I think when that got closely explored, they backed off because they were high utilizers as well. So I think the county had tried to align with MCF and then looked at that and said, we don't think this is going to be merging with that group is going to be a huge benefit. So.
And I'll tell you too, we're looking to add an additional cost savings. And I don't think we want to go into that right now, do we, or do you want me to touch base on the Mackenzie piece?
Maybe wait.
Okay, we're looking to add an additional cost savings piece January 1st. So it could bring significant savings to the plan and significant savings to you guys, significant savings.
Well, and you guys know, it's the discussion with Mackenzie.
In your letter.
It's a discussion with Mackenzie,
Okay.
yeah. And what the rates would be
Yes.
if you were to doctor with Mackenzie. And I completely understand people have concerns about certain treatments and going to things through Mackenzie, and that's your prerogative. But what it would allow is if you do anything through Mackenzie, again, lowered rates, if you go get your blood drawn through Mackenzie, you can do that at maybe little to no cost. Your kids have the sniffles and they go to the, clinic through Mackenzie. So I think there's some benefit. I do understand some people are dead against going to Mackenzie for some things. And again, we're not pressuring you one way or the other. We're just trying to create a cost savings if you do.
You're talking about that being effective this,
We couldn't get it for July 1, but what we want to shoot for is January 1.
so it will affect this.
The hope is we can get it, that's one of the reasons too, we switched networks too, to align with
Yeah.
that, because Mackenzie wasn't going, the network we were on wasn't going to align with Mackenzie.
Yeah, it's a direct contract, so they have to, there's specifics that Mackenzie says, we're only gonna do this. Meritain says, we're only gonna do this, and then your network, Aetna versus Cofinity will only, so in effect, your benefits that you have now, nothing changes, but it would add a third tier. So if you went to Mackenzie for these things, your costs would be significantly lowered or possibly nothing, meaning your copay, your deductible, that kind of stuff. And once that's all cemented, we'll do another meeting to make sure everybody understands exactly what that is. And again,
Change our, what we're paying.
no, because again, we've projected some savings and built that in, but we don't know exactly. We don't know how many people are going to say, I'm not going to Mackenzie. So, we've projected a little bit, but again, the hopes would be that would be higher. I know the concerns that we've heard in the past about folks going to Mackenzie with this being such a small community. If it were me personally, because every penny counts. If I had the opportunity to go to Mackenzie for something small and not pay anything for it, I would. But it, again, would be something completely voluntary to you guys, but I don't know what that savings would look like. So we don't want to overshoot, do a lower budget and then have to sit
Right,
here
but we
next
do
year.
know a percentage of our employees do use Mackenzie.
Yes, and we've got that built in.
Obviously, you've said it all day. You have every secret about my history of my health.
Well, what I want to say is I don't know who
I know,
has
I know.
what.
No.
I don't want to know that.
It is
Jody doesn't want to
pretty
know that.
significant if you do.
Right. I do know like member 9467 has this, but I don't know Jane has this. And again, I don't want to know. Jody doesn't want to know. Is somebody named Jane in here? Nathan definitely doesn't want to know. So yeah, that's something, that's a good question. But yeah, we did build in based off of, okay, we know this many people are going for these different procedures. Going to Mackenzie, there are discounts involved in what they would be charging the county for the different services. So, but again, the hope would be we're undershooting and we come back next year and go, great, we estimated 15% to use it, but 40% if you guys did. But again, I don't have a crystal ball. I wish I did, but I don't.
One of the key things I'm hearing today too is from a medical user or an advocate, we need to try to advocate in our employee force, workforce, to take advantage of these things. Because that's going to drop our rates next year. Like if I call the doc versus go into urgent care.
Absolutely.
If I do have a major medical condition, to reach out to Edison and get involved in our own medical care, and because it's not just us, but it takes care of the pool of people.
Yeah.
And I think one of the things we could offer from a health department perspective is in our monthly newsletter, a little, health wellness tips.
Mhm.
Remember, you can call your doctor by your cell phone. Here are these things to engage in to take care of your health as you move forward, because we all forget about those things and we gotta remind each other. And a newsletter could do that. And we could share that with, all county employees.
Yeah, spine surgery, for example, not only, is it misdiagnosed as a whole, but and I'm gonna give kind of an average, an average spine surgery is about $170,000. Aggressive physical therapy for a year is probably maybe on the high end 80. So you're looking at half the cost of that. Not only are you making sure that you're avoiding a painful procedure that you don't need, but you're getting a big savings as well. But I always use the term a good healthcare consumer or a wise healthcare consumer. And you can also compare costs of services within the Meritain website. So your member website or your app, if you don't have it set up already, strongly recommend, just like you shop for the prescriptions. It's more complicated, obviously, when you're shopping for medical care because you don't just want to choose the cheapest thing. But within that, it's going to show you not only the cost, the average cost, obviously, because there could be pieces that move, but the average cost as well as the outcome results. So certain places have higher recurrences, they're going to have to go back in, have more follow-ups, or maybe the procedure isn't done the way that it should be done. So it's going to give you that full picture. And again, I've seen $10,000 differences between facilities and maybe a smaller facility doing the procedure better because they do it more often than one of these larger facilities. Again, I shared, I'm a huge proponent of U of M. It's relatively close to my house. I've had great outcomes. I've also had a couple times where it wasn't a great outcome and I paid $9,000-$10,000 for something that I could have got at a smaller facility, not that one by my house that misdiagnosed me, but another one.
So you're talking about, for instance, of spinal surgery and spinal surgery versus the physical therapy. But isn't there like a limit of how many physical therapy appointments you can have?
There is, I think it's 60, maybe. It's a lot. So it's not meant to be, chiropractic is a lower maximum, for example. But if you're looking at physical therapy, there is going to be a higher, because again, we don't want it to be, you get 4 physical therapy visits. Now what? I'm not healed. We want to make sure that the issues.
That's what I was thinking when you were talking about.
It's chiropractic that has, chiropractic has a lower amount of visits.
Plan document be available somewhere, because I know with, we had priority and that was always available to look at, but with Aetna, I was never able to access that. I talked with them multiple times and they kept saying it would be there, it would be there, it would be there. And we never
send it
were able to look at it. because,
Yeah, it's,
hard to tell what was covered, what
Yeah,
wasn't
I just-
covered and.
Yeah, I just sent
Yeah, you guys have it on.
it. Shane and Bryant, you should both have it. I sent it last week.
It's a big document, yeah.
Okay.
That's a full
It's a big one.
document.
Yeah.
Yeah, because a lot of times, you'll
Sure.
get that question as to, what labs are covered, which ones aren't, and all that kind of thing. And it's like, you used to be able to just look at that plan document, you'd be able to see what was and what wasn't, but we didn't never get that with that.
Yeah, and it is available. It's a meaty document. But you can search, like I just put, it's a PDF, I think. So if you're looking at it online, just do a search to look for whatever it is that you're looking for. And all 3 of the plans are in it.
Also, live documents.
You guys haven't had plan changes in 3 years. So none of the meat of that document has changed. If it changes, we'll do what's called a summary material modification or an SMM. So you'll get that.
Difference between priority and Aetna. though.
Yeah, this is a different, this was drafted when the change was made. And if there is another significant change that's made, it'll be redrafted and you guys will know about it. But nothing has changed.
But what I'm saying though is like some of the stuff that priority wouldn't cover, Aetna did cover. like,
Yes.
In that actual, yeah.
It's in that plan
Okay,
document.
Perfect.
Yeah.
Very good. I think to your point, Brian, I think you hit it on the head in that we've identified, like I said, we've talked to Gibson about getting more information out to employees. Trying to further educate them. Hopefully we can pay attention and we can all work as a group to lower the costs, overall. So it's easy sometimes to, it kind of got me thinking a little bit in regards to some of the things we do and driving up to Mackenzie, with the kids multiple times through the winter when they're sick. And I thought, I could have just went on Teladoc and probably, it's things like the sniffles, things like ear infection, avoid some of those claims. So, but sometimes you're right, without reminders, without that being in your head, you don't even think about utilizing those things.
All right, if no one else has anything, I took an extra half hour of your time, so I apologize, but I wanted to make sure everybody understood and some great questions. And I will be here till 2, so if anybody has other questions, feel free to see me.
Is there a second meeting since I came in so late? I missed-
There's a Zoom meeting
Oh,
that
there
we're
is.
gonna have, yeah, I
Okay.
think it's tomorrow, right?
Oh, okay.
And I would suggest too, if you guys have spouses at home, maybe that you want, I always pick on men, but if your wife is at home and making the decisions, or your husband, and you want them to be able to hear things so you don't have to ask or answer a million things, have them join that Zoom. Anybody can, and that way they're hearing it as well. And I didn't mean to pick on.
It's not that we don't pay attention, it's just our wives have so many questions. It's trying to stump us. So, yeah.
It's on the live stream.
Oh, it is?
It's, yeah,
Okay, I'll go back and watch it then.
yeah, everyone's
On the
like watching it now. It's live and it'll be on the live stream.
Perfect.
All right, thanks, guys.
And we will have pizza